You're listening to the Reality of It All podcast, candid conversations about today's hot topics. And now here's your host, Tracy Osborne. Hey, everybody, welcome back to the show. We are talking about our pelvic floors today. And I know we've been covering this, quite a bit in the past few weeks, but, this is just something we don't talk about enough. And today we are specifically talking about our pelvic function in relation to childbearing, pre-pregnancy, during pregnancy, and post-pregnancy. With me today is Annie Hopkins, and she is a pelvic health physical therapist and yoga instructor. So, Annie, welcome to the show.
Thanks, Tracy. I'm excited to be here.
Well, this is a great topic, so I'm excited to have you. There's just so much to cover on this, and I've over the past couple of weeks, I've done interviews on this topic, and I have learned so much that I had no clue. And here I am, almost 50, and have had 4 kids. And, some of the things, especially like the, bladder leakage and things like that we all think is normal. I have learned that it's not normal. And I've just been blown away by how little I actually know about that area of my body. So, well, I'm sure I'm not the only one.
I was going to say, Tracy, you are not alone there, myself included. So I've been a physical therapist for 15 or so years, and I've been doing pelvic health for the past maybe 3 or 4. And even myself as a trained, expert in anatomy and physical rehabilitation, they skipped over the inner contents of the pelvic bowl. It was like, oh, here's your pelvis. This is where your hip socket is, and your glutes and your quads, and moving on. So it's really done a huge disservice, I think, to women over the years because of the lack of education. Because when we know what we're dealing with, we thrive. So there's a couple of different reasons for that, whether it's taboo or shame or fear or not polite society. We're taught so much shame around this area that it really doesn't come up until pregnancy usually is the first time that pelvic floor is even somewhat addressed, because that's where the baby's going to exit. And there's all this focus. So we go from hide away your pelvic function, hide away your sexuality, hide away, peeing and pooping and all of that stuff because it's air quote dirty and shameful, to all of a sudden, here we are pregnant. Everyone's getting up in there, knees apart on the table. Everyone's poking around. There's a resident, a nurse, a student, everyone's learning.
Yep.
Right. And so it's just one of those things that I hear often from my clients, oh, I've given birth, nothing bothers me anymore. Or, you can do whatever you want down there. And I really take time to stop people and say, no, you need to be educated, informed. And if you don't want anything that I'm offering, it's not going to happen, because it's just an agency that we don't get in the medical care system in America. So I won't go too deep into that soapbox, but yeah, pregnancy is probably the first time that people become aware of their pelvic floor. And what people think of when they think of pelvic floor, if they think of it at all, is probably Kegels, right? Yep. So do your Kegels, do 100 Kegels a day, do a Kegel every time you are at a stoplight or something like that. Mm-hmm. And this is rather outdated information. And it's just simply, it's an isolated pelvic floor contraction. And it's named after an OBGYN back in the 50s. His name was Kegel. That's his last name. And so the move was named after this doctor. And while I appreciate him for shining light on the rehabilitative efforts that are needed for the pelvic floor, I am proud to say we have evolved and grown past that. And I would really like culture and science to catch up with that. So, and so not everyone needs to Kegel. That's the number one myth. Not everyone needs to Kegel. And even whenever there are studies out there that have shown that when people are attempting to do a Kegel, something around 40% of people will get it wrong. So they will be doing an incorrect move, which really doesn't help and sometimes actually can worsen symptoms or worsen someone's conditions. So.
Well, sure. It's muscle training. So, think of going to the gym and you're doing your squats wrong with the wrong form. You're not actually building your muscles properly, and you could seriously injure yourself. So, it's kind of the same thing. And, I'm like everybody else. Kegels, you mentioned the word, and I immediately it's like Pavlov's dog. I just start doing them. And who knows if I'm doing them right? I don't have a clue,
Right.
Yeah. And, like your client that you were talking about, I'm one of those. I've had 6 pregnancies and 4 kids, 4 live births. And I'm just kind of like, whatever down there, when it comes to that, pap smears, pelvic exams, all of that, just whatever. I don't even fold up my underwear and hide them under my jeans anymore at the doctor's office. I just throw it all over the place, because rebel. It's like, once you've seen it, you've seen it, it's not a big deal. And, when you've had 4 kids and like you said, tons of doctors, nurses, residents, students, the janitor, they've all been in the room while it's like, hey, whatever, more the merrier. Right. It's a party. But, you're right though. We still need to be aware of what's happening down there and be aware that, there are things that I think the medical profession thinks we need to do and have that we don't necessarily need to do and have.
Yeah. So. And isn't it funny that despite that parade of professionals that have, poked around down there, how little one actually knows about that area. So just the education that is provided or the lack of education that is provided along with all of these things is just probably one of the biggest disservices. That's my platform overall. A lack of education is a disservice to the public. For sure. And
there is a huge lack of education. I, embarrassingly enough, did not know that you don't pee from your vagina.
So many people
I did not know that until about 4 years ago or so when I was taking care of my stepmom and she had, bladder issues and she had bleeding from down in there. And the doctor's like, well, is it coming from her vagina or is it coming from her bladder? And I'm like, dude, hello, you've been down there? It's like the same area. And I had no clue that it wasn't. And I'm like, oh my God, I'm in my 40s and I'm just learning this.
Right.
They don't teach us this in health class in school.
No. And in health class, because, again, we have that societal taboo. And so then we rely on our parents or our family units.
Oh, our parents didn't to teach us that at all.
They didn't talk. Exactly. They didn't talk about it at all. And so again, this lack of education, we can't teach that at school because of shame and maybe religious beliefs and all of that kind of stuff. So we're not getting a general public education in health class or even in PT school. Like I said, they skipped right over it. They're like, well, yep, that's inside the pelvis. And that's where urologists go and physical therapists stay on the outside of the pelvis. So it's just, you're not the only one who didn't know that you don't urinate out of your vagina. I hear that very often. And sometimes people are like, how could you not know that? But it's so easy to not know that, just the way that our society is set up. So that's why I do what I do and I talk about what I talk about. And it's not weird. It's not shameful. It may be at first, but we want to grow past that shame and that fear. So, if you want, I could just kind of talk through how you would identify your pelvic floor.
Yeah, so that, definitely.
Listeners could even check in. So
yeah.
One, there's lots of anatomical pictures and stuff online. If you look for pelvic floor, you can always Google it if you're a visual person to see. But otherwise, if you just think about where your sits bones are. So your sits bones are the two bony parts at the bottom of your pelvis, at the bottom of your butt that you sit on. And so in between those two, you have a right one and a left one, is some pelvic floor musculature. That musculature also extends to the pubic bone towards the front and the tailbone towards the back. So we have this diaphragm almost of muscles that spans between the pubic bone and tailbone and sits bone to sits bone. And this muscle is voluntary, meaning that we can say, hey, muscle, contract, and it contracts. Now, that's much easier said than done because there's a lot of other things that assumes that our brain has mapped it out with ease where our pelvic floor is. Like if I said, clench your fist, you'd clench your fist. Flex your bicep, clench your pelvic floor. Maybe we know what that means. Maybe we don't. So it's there. Or if you were to sit on a bike seat, the soft area that is contacting the bike seat is your pelvic floor region. You could also sit on your hand and feel that same area. It's okay to sit on your hand and acquaint yourself with this, even if it's just
absolutely
through your pants, right? And so what a pelvic floor contraction might feel like is kind of a drawing together and up of these sits bones, or the space between the vaginal opening and the anus is a space called the perineum. And this is the part where we become familiar with after it tears during a vaginal delivery or after you have an episiotomy. So that's
been there,
done that. Sad that sometimes that's your first introduction to this area is after it's been injured. Yep. So again, I encourage everyone to look, feel, and become acquainted with this area at any point. Start at any point, but it is really beneficial to look and feel around if you are pregnant or planning to have kids so that you have a normal baseline. So that area between the vaginal opening and the anus is called the perineum. And that's an area where you can feel or see pelvic floor contraction. When it contracts, that would pucker up and in. When it relaxes, it would kind of bulge down and out, but not excessively. So those are some ways that you can kind of get acquainted with your pelvic floor. Another place to get acquainted with your pelvic floor and does it move? Do I even know where this is on the toilet. So every time we pee or poop, our pelvic floor relaxes and opens to release and eliminate. So even just next time you go to sit on the toilet, see if you can feel that kind of descent or that opening. It's going to feel like something different for everyone. So if the words that I'm using don't resonate with you, that's fine. What you're feeling is correct. Doesn't have to match my words. But that's another place too, where you can sense, okay, this is my pelvic floor relaxing. And then when you go to stand up, that's your pelvic floor contracting. So there's lots of ways to just kind of get to know that area. And again, I encourage people to do it before there is a pregnancy and a childbirth, because that changes this area. So oftentimes it's the first time that you're looking at this is postpartum when you go, oh my gosh, what just happened? You know, some people are scared to look. Some people it hurts too much to look. Or they're too ashamed to look, but it's just sometimes it's a more challenging place to start from is after an injury. And I don't love using that word, but childbirth is an injury.
Childbirth is an injury. Yeah.
It's a big time change. You know, our bodies grow and shift over 9 months, which means our skeleton is shifting, our muscles are shifting, our hormones are changing. And then we go through an event that is called work. It's labor, right? Labor means work. So we go through it.
Yeah.
And then on the other side, our body has just undergone this very quick shift. So we grew over 9 months and we change over the course of a day or so. And
that's after we squeeze something the size of a watermelon out the opening of a size of a lemon.
Exactly. Exactly. Or through an abdominal incision, through a major abdominal surgery. You know what I mean? So we're left with either a massive, drastic musculoskeletal shift or a major abdominal surgery. And it just boggles my mind. In fact, when I was a PT student, 20 years ago, I wrote a paper petitioning OBGYNs to send their pregnant and postpartum patients to physical therapy because physical therapists are rehabilitative experts and the body needs rehabilitation after childbirth. And I stand by that statement today. And, if you had ACL surgery, if you, sprained your knee, if you have back pain, you go and you see a physical therapist. But childbirth, either vaginal or cesarean, is just like, well, rest for 6 weeks and then do whatever you want.
Pretty much. And, I never even heard about pelvic physical therapists until a couple of weeks ago when I was recording another podcast interview. I was like, I didn't even know this was a thing. And, and she had said the same thing. You want to go see one after childbirth to help get your body back to where it's supposed to be. And I'm just like, okay, so what do we even do in a physical therapy session? It's not like you're going to pull weights with your vagina,
Yeah. Yes. There's a place for it, but there are vaginal weights out there, or yoni eggs, or jade eggs.
Oh, well, yeah, those kinds of things.
Yeah. But those aren't for everybody, because it depends on what the issue is. And, while we are culturally conditioned to think of a vagina becoming too loose or too weak and floppy after childbirth, we are seeing actually the almost exact opposite, especially over the past 3 years with this pandemic going on. We're seeing an increase in tension in the pelvic floor. So it's clenched, it's tense, it's spasmed. And that causes its own dysfunction. So having your vagina be tight, air quotes, actually is not a beneficial thing. We want a vagina or a pelvic floor that is responsive. So it relaxes and it contracts. And that's just the same as any other muscle in your body. So if I went to hand you something and your fist was already clenched, you can't reach out and receive that from me. Your hand doesn't work. It's not functioning. Your hand needs to be able to relax and open and then close again, right? That's a functional, responsive set of muscles. The same thing is true with our pelvic floor. It needs to both open and relax and contract and tense up. So when the pelvic floor is too tense, we also see dysfunction, because pelvic floor helps with functions like sexual intercourse, bowel and bladder, and supporting our internal organs. So if that muscle is already at its max contraction, it also can't do its job. And so we might leak urine, have pain with sex, or have that feeling of prolapse, which is like a bulge or a heaviness in the, or a dragging sensation down near the vaginal opening. So that's myth number 2 out of 2000. Pelvic floors don't get stretched or weak or floppy or anything after childbirth. So again, that means that not everyone has to Kegel, right? So if your hand was clenched and you went to someone and they said, here, do this squeeze, just squeeze this ball and your hand will function again. You'd be like, dude, my hand is already squeezed. Why would I squeeze something if I can't open my hand? That's not going to address the issue. So that's where Kegels, clenching and squeezing the pelvic floor, is not the answer for everybody. If it's already clenched and squeezed, we need to work on opening it and lengthening it. So pelvic floor physical therapy session, we do a head to toe assessment, because the other myth is that it's just not pelvic floor. It's just not those muscles. The way that you breathe affects your pelvic floor. The way that you sit affects your pelvic floor. It's literally the center of our being. So it's literally involved in everything that we do, which again, the training something in isolation when it's really part of this global function is not the complete picture. So again, just squeezing a weight or doing a Kegel at a stoplight is, may really miss the mark on what's driving this, this dysfunction or this issue. And I also 100% believe that every postpartum person should see a pelvic floor physical therapist, whether there are issues or not, and because like you said too, it's so common to leak postpartum that that's sometimes not even seen as abnormal. It's like, well, you joined the mom's club, honey.
I was just thinking about that, because you mentioned that if it's contracted too much, that will leak urine. And I always thought that was the opposite. If it was too open. That's why we're leaking when we cough or we sneeze, or
it could be both.
And
it could be either.
Yeah, definitely. It's welcome to the mom's club. It's, goes right along with hemorrhoids and stretch marks.
Exactly. And so hemorrhoids are also a pelvic floor, can be a pelvic floor driven dysfunction as well, because a hemorrhoid is a vein or a vessel that's gotten too overloaded with pressure, and it's just kind of stretched a little bit. And now we have this little extra part of the vessel wall that bulges out some. And so if going back to that clenched pelvic floor, if the pelvic floor is clenched all the time, that means that there's increased pressure through the region all the time. And that means that hemorrhoid is going to be much more symptomatic than if that pelvic floor were soft and it gave space for that vasculature to just flow without that increased pressure, if that makes sense. So again, it doesn't have to be the classic leaking or leaking pee or poop. I will say that here, because depending on how your birth went, there can be issues with fecal incontinence where you don't have control over your bowels, or you don't have control over, farts. And we want to talk about shame. Like, let's talk about not being able to hold in your poop, right?
Yeah.
But it is a thing. It's absolutely a thing. And it's really not talked about. I have clients who would leak stool after so many miles on a run. And they either would just poop their pants, like wear a diaper and poop their pants, or they planned their runs based on bathroom location.
Well,
but they never thought to ask.
Yeah. You hear that that's really common with marathon runners.
Mm-hmm. Yeah. Right. And it's just become accepted as part of the culture.
Yeah.
Which is just interesting. And I don't know, now that you say that, I'm interested to see, there's probably no stats, but if male marathon runners and female marathon runners all experience that fecal incontinence, because men have pelvic floors too. If you're a human, you have a pelvic floor. Women's are just much more, much more involved in their lifetime because of childbirth. But all of these things could happen with the male as well.
Interesting. And I could see where fecal incontinence, I know that, I am a really open person. I have no problems talking about pretty much anything. I think I would have issues talking about that. I think I would be super embarrassed to, come on here and say, yep, I leak poop all the time, because it's not something we talk about. And it's not something that's quote unquote accepted by society like it is with urine incontinence.
Yep.
So I can see where, that could be definitely cause people to feel shame and embarrassment, and they wouldn't want to tell anybody, especially their doctors.
Right. Right. Because they've never heard of it before. They must be the only person with it. There's something wrong with them. They're dirty. Right. Why would they ever speak up to that? Because, and then it's probably just like, oh, even if you have heard of it, like, oh, that means I have to get surgery. And again, pelvic floor PT can help with that as well, because that, managing bowel and bladder is one of the functions of the pelvic floor. So there is hope. There's no such thing as TMI in a pelvic PT's office. If we don't hear it all, I ask for it. I seek out this slightly awkward information about your bowels and bladders, whether you can orgasm, whether you have pain after sex, all of these different things. So, and I, reach out, find a pelvic PT. We're also very open to these discussions. You can reach out to me. We need to discuss and educate, because there is hope. There's a way to get through this. I was looking at some stats before we hopped on, and it's for prolapse. So prolapse is whenever one or more of our pelvic organs, bowel, bladder, or uterus, can descend into the vaginal canal.
Right.
And either stage 1 is inside the canal, stage 2 is right at the opening of the vagina, stage 3 is 50% past, stage 4 is more than 50% past the opening to the vagina. So again, another thing, my organs are falling out, I'm broken, my husband will think I'm hideous, all of that stuff. Not true. But 40 to 50% of women do have prolapse, and the average time of onset is sometime in your late 50s. And the way, when I saw that average, I was like, oh, I wonder why that is. But then I think back to the lack of education, and prolapse is a pressure management problem. So what I mean by that is, after we go through pregnancy and childbirth, our core is weak, right? Your abdominals were just stretched out and now they're deflated, and they're like, how do we even function?
Right.
Like, we can't even. So what we tend to do, because our bodies are amazing and adaptable and they will figure out any problem, we tend to hold our breath, because that creates a form of stability through our midsection that will get us through our day. Because we have to go pick up that crying baby. We have to get out and go to the grocery store. We don't have time to lay in bed and rest and recuperate, which I take strong issue with. We need to have our childbirthing people rest and recover. That involves paid leave. That involves a whole societal, it takes a village. Our village
more than a day and a half in the hospital.
Oh my God. Yeah.
Yeah.
Yep.
Yeah. That's a whole nother call. That's a whole nother show.
Whole other thing.
I agree.
So then, so if we aren't taught to actually re-engage our core, and we go with this breath holding strategy for decades, then when menopause hits, that's the next time that our vaginal tissues change. And that's usually when prolapse shows up. And that's what this, study showed about the average age of onset being in the late 50s. I was like, oh, menopause, whenever our estrogen levels drop, our vaginal tissues become drier and less adaptable. Not adaptable, that's not the word I wanted to use, less responsive. And that's when, the straw breaks the camel's back, and you sneeze, or you have a difficult poop, you're constipated after traveling or something. And all of a sudden there's this bulge of tissue at the entrance of your vagina, and you freak out, and you go to Google, and Google's not always your friend here. And then, you feel like your life is over and can never be fixed again. So I
definitely don't go to WebMD, because it'll just tell you that you're dying.
Exactly. So, but again, this is 40 to 50% of women, and the lack of education that we have around it is just shameful.
That is scary, considering the fact I'm like 2 weeks away from turning 50. I'm like starting to kind of freak out here a little bit.
But you don't have to freak out. And it just, if you're it doesn't have to happen, and they say that, it increases the risk of prolapse increases with the more vaginal deliveries you have. But I just started thinking, like, but what if we rehab those people after each vaginal delivery? Would we still see 50% of people over the age of 55 suffering from prolapse? I think maybe not, if we actually rehabbed people at the time of injury and didn't let them compensate for 25 years and then see the results of their compensation. So, I mean, call me crazy, but that's what I think.
Definitely. Wow. This has been like,
talk forever.
I know, this has been like so informative. I mean, I keep it, like I said, I keep having these conversations on this podcast about the pelvic floor, and I'm learning new stuff with every single one of them. Now I have to worry about prolapse.
You don't have to worry about prolapse. Go find yourself a pelvic PT.
Yeah.
And, just seriously, like, demand it. Go to your OBGYN, or if I'll back up. Most states in America have direct access. So you could walk into a PT's office and say, hey, I have shoulder pain, or hey, I'm worried about prolapse. And we are qualified to treat you right then and there. We don't need a doctor.
You don't need
a doctor's note. No.
Yeah.
Clinically speaking. Insurance speaking, that's when the need for a referral might come in. But, that's where I just ask, speak up. Could I benefit from pelvic PT, or just reach out and find one.
Right.
Just start, right? We're great people to know. And, we talked a lot about like bowel and bladder and stuff, but our pelvic floor is involved in our deep core. Our deep core consists of pelvic floor, diaphragm, our breathing muscle at the bottom of our rib cage, our deep abdominals, and some spinal stabilizers deep along the spine. Those four muscle groups contract together to stabilize us as we function. So when one of those is kind of out of commission, we see some compensations in other places. So nagging back pain that won't go away, hip pain, groin pain, anything like that. You know, a lot of people say, oh yeah, I got a bad back after I had my second kid or something like that. And it's never been the same since. And it's something that we live with. We take a Motrin every now and then, whatever. But the culprit could be pelvic floor, either overactive, too tight, or underactive, not firing efficiently. And there's been times where I've done internal exams where I've pressed on a tender spot in the pelvic floor muscle and people go, oh, that's my SI pain. That's my low back pain. And I've recreated it by touching the muscle, which is similar to like in your upper back and shoulders. If you find a point and you press on it and it like radiates up into your head, or it kind of goes in towards your jaw or down into your back, like it's the same thing. When you find a tender point in the pelvic floor, it can radiate and mimic another symptom. And so if you've also been trying to rehab that nagging hamstring pain or groin pain or back or hip or anything in that pelvic region, there is it's a good idea to check in with pelvic floor as well. Because again, the amount of times that I've touched on something and they've gone, oh, I feel that, or in my low belly, I feel that in my lower belly. And so with internal exams, because this is the other question that I get quite a bit, is like, what does that mean? So it's both similar and different to an exam you'd get at your OBGYN. We do not use speculums. It's just one gloved finger inserted. And really what we're doing is feeling for the musculature. So we can press down and kind of feel if there's any knots, just like I would if I were pressing on your shoulders or in your back. I'd be like, ooh, this tissue is more dense here. Or we'd ask you to contract and say, okay, that was an effective contraction, or, oh no, I felt, something over here, but not over there. And so really we're assessing the musculature. So we can do it laying down or sitting or standing up. And this becomes important with folks with prolapse, because when you're laying down, maybe your prolapse doesn't bother you at all. It's when you're climbing stairs or standing up. And so that was when we would do like a standing assessment and say, okay, what's happening in your body when you're standing up? So it's right. Interesting.
This is actually incredibly fascinating.
Yeah. And it's, we're looking at function. OBGYNs are looking for something different. They're looking for organ health and cervix and all of that kind of stuff, which is all super important. But if you're looking for someone to assess the strength, the dynamic function of a muscle, like that's a physical therapist and one who's been trained in pelvic work, because not all PTs are trained in pelvic work.
Right.
And there are some out there who might hang out a shingle. Oh yeah, we can help with that. But do your research and ask, okay, what certification did you get in pelvic floor assessment? Or, how many people have you helped with this condition before? Right. Ask, because if they stutter and stumble, then your next question is, okay, who can you refer me to that is trained in this area?
Right.
So,
well, Annie, thank you so much for coming on and enlightening us all today, because I'm sure the listeners are learning just as much as I am. This has been incredibly fascinating. So I appreciate it. Thank you.
Yeah, you're very welcome.
And listeners, I will have all of Annie's contact information in the show notes. If you just head over to therealityofitall.com and pull up Annie's episode, all her link to her website and everything will be there for you. So if you have questions, concerns, you're not sure where to go, who to talk to, definitely reach out to Annie and she'll point you in the right direction. So Absolutely. Again, thank you for coming on. Listeners, as always, thank you for tuning in. We'll talk to you in the next show. That's it for today's show. Thanks for listening. Be sure you subscribe to us on your favorite podcast platform. Don't forget to follow us on Facebook, Twitter, Pinterest, Instagram, and TikTok.